So we're going to go over the S1 fitness case study, and we're going to look at Bob. He's our client that the screening has been done on, and we're going to look at his history, all of the things that he has told us on his intake, and then we'll look at each of the problems, and from those problems we're going to list the goals so that we know exactly what we want to work on in our program. From those goals, we'll start to select some exercises, and we're not going to put them in an order yet, but we're going to select them so that we know what do we want to include, what are going to be the really important exercises to include in his first 1 or 2 sessions so that we're starting to maximize our time with the client. We could do just a regular program, which would probably be pretty good, but if we can make it more specific, then the client's going to have a better outcome and we're going to reach the goals a little bit sooner. So starting with Bob, he is a 42-year-old male and he's overall healthy, but as most people are, sedentary desk job. He has a left shoulder injury 10 years ago, and it's really common that you'll see there's nothing written about that. It doesn't tell us what it is, and that's really common, especially if it was from 10 years ago. People don't remember. They're not very good historians, so often they'll just say, oh yeah, I hurt my shoulder. And so that's very common that will happen in real life. He also had a right femur fracture 6 years ago during skiing. And again, we don't have any more information about that, but 6 years ago, and he feels pretty like he's overall healthy. He probably had a good result from that. Okay. His fitness history is that he is currently walking 2 times a week for about 30 to 40 minutes. Previously, he used to work out at the gym, but not for many years. So we don't know why. If he was our client, we could ask him and get a little bit more information, but quite often we're just given basics, and we have to work from that. So this is what we have. Okay? His goals, which are really important, his goals are to eliminate the occasional left shoulder pain that he has, to improve his posture, and he wants to return to working out at the gym. So those are his goals, which we're definitely going to take into consideration as the total list of goals, because we want to make sure that what he wants is being represented in what we're doing. All right, so on his fitness assessment, we can look through. He had a lot of 2s, which is kind of a very average score. He had a few 3s and things that he did really well, and a couple of 1s that are going to be, anytime there's a 1, that kind of sends up not a red flag, but makes it really important. We want to know why is it that they couldn't do something in the fitness screening. Okay, so in the half squat, he scored a 2 on that. And the note to the side is that his heels lifted off of the floor, so he wasn't able to keep his heels down. So what might be some possible reasons why he wouldn't be able to do that, why he wouldn't be able to keep his heels down in his squat? Possibly, yeah. So maybe he doesn't have good flexibility through his calf muscles, or we think sometimes the Achilles. We could think maybe just kind of thinking out of the box a little bit. Maybe there's some ankle mobility that he doesn't have that we could improve upon. And we know that he had a fracture in his femur, so maybe just how he moves is a little bit different than the norm. So that would be some good things there. So how could we? So let's write that up there for our first problem. I'm going to use the arrow signs up and down for increased and decreased, just as an abbreviation to make it a little bit faster. So we're going to think that he has some decreased, let's say calf flexibility. Okay, all right. And then what about the full squat? So on the full squat, he also got a 2. What are the things that were going on there? So his right foot was pronating, and his right knee was moving toward a valgus where the knee is coming in, and we're creating that kind of L shape at the knee. So right foot going in, right knee coming in. How could we represent that in a very general way? Because we don't know why it's happening. We just know that it is happening. So how could we write that?
Just some type of, upper hip imbalance, like something maybe from the outer side, or like his inner thigh is kind of, or his like out here isn't being able to hold his leg.
Possibly. So he might have some some weakness, but we don't know. We don't know that for sure. But what we can say definitely is he has poor right lower extremity alignment. So that's something we can say with certainty. The why, we don't know necessarily. It doesn't tell us, but we know that he had an injury there. So I would say that if we put that down, that'll be enough to get us going on the exercises that we want to choose.
So yesterday you wanted, it's more of a general, not super general, but overall, like what's going on in the body.
Yeah, it is a little bit more general because again, we don't know. I mean, if I was a physical therapist doing a physical therapy evaluation, I might ask him I might combine the two things together. I might ask to do the screening test, but then look at it from a physical therapist's eye and say, okay, well, why is that happening? Well, there's some joint mobility that's not present that should be, or there's too much joint mobility, or there's strength, or something like that. But in the fitness assessment, I can't do that. I don't know that for sure. So all I can do is note it, look at it, and then put it down so that I know to work on it. So I'm going to choose exercises that are going to help him with his overall alignment in his leg. Yeah, which might be strength-based, but it also might just be awareness-based. Maybe he has the strength to do it and he just can't. Okay, so that's good question. So decreased, get the D's in there. Right, so I'm gonna just abbreviate with an R, and I'm gonna abbreviate lower extremity, LE, alignment. Okay, our next thing is the heel raise. So we're standing on one foot, lifting the heel up and down. And he has poor balance on his right leg and he needs assistance. So he cannot independently lift his heel up and down. So he needs that assistance for balance. So how much you rate that? Basic. Decreased on the right leg. You got it.
Can you assume a little bit that it might be strength related as well? Because if he can, well, I'm just thinking about heel raise. Like you need to have some strength in your leg to be able to lift your, be able to come up on your heel. So
you do.
You're saying it would be maybe a decreased, muscular, or not that he has muscle tone, but like decreased strength on the right side? You
might see that. So if you're watching him do the heel raise, and it's all over the place, right? Very low excursion. So the heel lift is pretty low, and he really is having trouble balancing, and he's probably having trouble balancing just standing on one foot. And you take him to the wall, or you let him put his hand on the foot bar or something, and he's still, with his hand on something, still can't get very much range of motion or can't get his heel to lift very high, then you might think that that's a little bit more strength related. If he's doing really poorly on his own, and then you give him something to hold on to, and all of a sudden it's like, woo, up and down, and it's perfect, and it's really high, and everything's good, you're going to think a little bit more maybe alignment, so how he's organizing himself, or balance, or both. Yeah, which one will affect the other. So decrease right leg balance. Good questions. Thanks for asking those. All right, so the goalpost got a 2. Unable to fully abduct the left arm. So he was able to stand up, his posture was okay against the wall, he was able to get to his goalpost position with the arms bent, the capital E, but then he lacked range of motion to continue to the fully extended position. So that's the left, decreased, left, shoulder, range of motion, ROM, range of motion. All right, so now we're to our 1. And like many people, hamstring flexibility is a challenge, especially for men. It just happens to be. They just aren't involved in activities where they need to have a lot of flexibility and range of motion. They don't challenge that. They don't do it a lot. So as he was sitting in his long sit position with his legs in front, he wasn't able to get his pelvis up, which would get him a 2. So decreased hamstring flexibility, we can put. I'm going to abbreviate HS for hamstring. Flexibility, because we're talking about a muscle instead of range of motion or mobility. Okay. All right, so into our abduction. So got a 2, wasn't too bad. He was able to get his legs almost all the way. So 65 degrees on each side would be our equivalent of the total 130. So actually for that, that's not too bad. He was very close to getting a 3. So I'll put it in, and probably, as with a lot of people, we'll come up with a total idea about they have decreased lower extremity flexibility kind of throughout. Then we can always note if it's all kind of the same and one really stands out, then we can note that to make sure that's more of a priority than general hip mobility and flexibility. So decreased adductor flexibility. All right. So now we're going to get into the spine and into mobility and core control through the roll-up and the 100. And he got 2s on both of those. So again, 2 is kind of average. It's not a 1 where he couldn't do it at all, but there were some problems that didn't allow him to do it fully. So oh, sorry, we forgot the Z-sit. Let's go back and do the Z-sit. So again, looking at now hip mobility, a little more than, it is muscular, but it also can be more hip joint mobility. So he got a 2, and bilaterally on both sides, he wasn't able to get the sit bone down enough, the ischium down enough to allow him to have a more erect spine position. So he got a 2 on both sides. So we'll just add that to the decreased hip. Whoops, mobility. Okay.
And there could be some knee too, probably.
There could be, and it doesn't specifically say that he had hip pain or knee pain. So make sure when you're writing these things down, the better that you can list this information on this column here where each line is, the better able you're going to make a really specific program for this person. If you just put, couldn't do it, there's 10 reasons why maybe they couldn't do it. So be really specific, and ask questions. Now, does that, what do you feel prevents you from doing this fully? Oh, I feel pressure in my hip, or I feel pressure in my knee. And sometimes it's the front leg as well. It's not always the internally rotated leg. Sometimes it's the front leg going into external rotation, and sometimes it's purely just the body. They just don't have enough body mobility to get themselves up and over their pelvis during that.
Is that when you say mobility though, because the hip are rotated?
We're looking more at the joint.
Okay.
Yeah. So I try to be clear with joint being more talking about mobility and muscles talking about flexibility. Okay. Yeah. Yeah, and I'll throw in range of motion in there too sometimes. But okay, so now on to the roll-up and the 100. So the roll-up, he got a 2, and it says that he had poor lumbar articulation. And then at the same time, I often look at the roll-up and the 100 together because they will probably share some information. So in the 100, he didn't have very good control of the abdominal wall. So we can assume as it was bulging forward, he wasn't able to maintain the transversus active, maintain that more consistent intra-abdominal pressure. There's some changes, but we don't want a blowout, right? So we want to maintain that as much as possible and breathe into the rib cage so that there's adequate movement of the diaphragm, and we can take a full breath but without losing control of the abdominal wall. So we'll put those on there. So poor lumbar articulation. So I'm again probably going to use a decrease. Now I'll jump up here and start a new list up here. So decreased lumbar spine, I usually abbreviate with an L and an S, lumbar spine. You can put L, just make sure that it's different than left. So a plain L may not be clear enough. So LS is a pretty standard abbreviation. So lumbar spine. You could put range of motion or mobility or flexibility. We don't know exactly what it is, but we know he just doesn't have it. Or you could put articulation also. And then let's put articulation, and I'll abbreviate it. And then it's important to know in what direction. Because if you screen the person and I'm going to develop their exercise plan, I don't want to have to rescreen them. I don't want to have to do it again and look at them and go, oh, okay, well they have poor mobility, but in what direction? Obviously in this, you can guess that it's lumbar spine flexion because that's what we're doing. but some weird things happen. So just be really clear with it. So lumbar articulation into flexion. Okay? And then we can put also decreased core control because he didn't have control of the abdominal wall. Okay? All right, now the next 3 tests, the side lift, the push-up, and the Superman, he scored a 3. That's great. Good, so he's pretty strong. So those are looking at both core strength and shoulder girdle strength, right? The stability of the shoulder girdle, as well as Superman starting to get into some extension, which is a little bit different. But let's look at the first 2 of side lift and push-up. He lost a little bit of stability on his left side. So that makes sense because he had a left shoulder injury. So in that position, maybe there was just a little, it was just off of being perfect, but the control was enough. So that's why there might be times where somebody scores a 3 and you still write a note down next to it. Because again, you want to have as much information recorded as possible. So side lift was good. Instability through the left scapula, so we can put that on. We only have, so far we've only talked about his left shoulder range of motion, which seems to be much more significant. He doesn't have enough range of motion, but he can get a decent amount of stability. So we'll put that on there just in case it comes up and we can continue to work on it, even though it's not a huge priority. So decreased left shoulder. I'm going to abbreviate stability as STAB, so stability. All right, so then looking down, let's go down to the prone shoulder flexion. So again, this makes sense. He wasn't able to get full range of motion on his goalpost test. So we can, most of the time, not always, but most of the time, those 2 will go together and they won't have enough range of motion and or strength to lift the arm off of the floor. So he was able to get a 2 to get his arms fully overhead or almost overhead while lying on the floor. So that got him a 2, but he just wasn't able to go that extra little bit to be strong enough to lift. And sometimes it's a range of motion problem first. So maybe because they're in a position where they're being pushed to the end of their range, they don't have enough strength. But if they had more mobility, they would have enough strength. So we don't always know why that is, but we can guess that, and you'll be able to guess that because the person will be there in person with you. Okay, so how would you knowing him, what we know on the paper, how would you put that? Would you put range of motion? Probably. Yeah, because he already didn't have that there, so we can put that down that way. Oh, we already have it.
Would you make a note that also in prone he had the issue too? But it's probably the same difference, right?
You could make any notes to yourself that you want. If you want to know a little bit extra, there can be a subnote, absolutely, if that helps you. Because it may help you in choosing exercises, right? You may at first shy away from those that would put him at that end range. So an exercise, thinking ahead in the curriculum, an exercise like swan from the floor, that might not be appropriate for him to start with, right? Because he can't get into that position for whatever reason. Or swimming, possibly. But it would be often the things that you don't want to do in the beginning are the things that you're going to do at the end. That's our goal. Can't do it now, but let's see how close we can get to. So that can lead you to what might be some future exercises that you want to do. All right. So we've got that. Let's go into prone press up now. So the prone press up, he also got a 2. And what's the purpose of the prone press up? What are we looking at in the prone press up test?
Is there a smooth extension of the spine without segmental hypermobility? Okay,
so getting the entire spine to go into extension, right? And we often talk about that when we're doing the exercises, but also when we're looking at the screening, is we want to facilitate or see if people can get into thoracic extension that matches the lumbar extension that they already have. So we wouldn't think I'm going to do the swan and I'm just going to increase lumbar extension. I want to increase thoracic extension first, see if I can get it pretty close to being symmetrical, and then in this case, to do the full press means that I have to be able to sustain it. So can I do it and can I hold it through a range of motion? Great. So he was unable to. He got a 2, so he wasn't able to do that. And it talks about hinging at the lumbar spine and at the cervical spine. So we could say maybe that there's a hypermobility at the lumbar spine and the cervical spine. But what else does the test tell us?
He doesn't have much mobility in his thoracic.
Exactly. So he's really lacking thoracic mobility. So we're going to write that down because it's probably, we know that he has some loss of core control, so we already know that that's an issue, and that will help him to be able to stabilize the lumbar spine a little bit so it's not too mobile and improve the thoracic mobility. Great. Really good.
He's sedentary desk job, so you can imagine he's...
Oh, I know. It doesn't help him at all with any of his problems. All right, so decrease, and I'm going to again use the same type of abbreviation, TS, thoracic spine mobility, or let's see, we used articulation, so let's keep with that. Articulation into extension. All right, last test, prone knee bend. Can't reach the foot. Probably the most embarrassing test for most people. The push-up and this, where they're doing this. It's back there somewhere. Any moment I'm going to grab it. So what does that tell us? So he doesn't have very good flexibility through the quadricep, the hip flexor, right? The rectus femoris. So we're going to be able to work on that a lot in his program. So I'm going to put that back over here, even though it's the last test. I'm going to put that back over here where the rest of the lower extremity tests are, because we may end up finding some things that are going to help everything in that general area. So decreased, I'm going to put quad / hip flexor, flexibility. Okay. So now what do we do? You got all that written down. Now what happens?
So match each of them with the goal to correct.
Exactly, right. It's actually the easiest part of the entire process. If somebody has decreased something, our goal is to increase it. And one of the words that I like to use, sometimes it really increase is the best word, but sometimes improve is a nice word. So we're not just thinking quantity of something, we're going to get, this many more degrees of something or this much more strength, but we're really going to improve it. Okay? You can use whatever speaks to you, whatever seems the most natural for you. So for Bob, we're going to look at lower extremity for him. If we think of these first tests here, we're going to look at improving his flexibility, right, which goes down with the mobility and the flexibility through the legs. So I would put as a general goal, improve lower extremity flexibility. And then I can put in there, because the calf isn't always one that we see, I would make sure that I know that the calf is part of that, and I would make sure that I know that it's kind of total leg flexibility. Okay, and there's many exercises. We'll choose some that are going to address that. Okay. Then we've got balance and alignment. So we're going to improve his lower extremity alignment. We're going to improve his balance, especially on the right leg. And the way I do it is I just change, instead of having the downward arrow, in my goals, I'm going to put an upward arrow. So I want to improve that, I want to improve that, I want to improve, so that we know that's what it is. And you do need to get in the habit of restating it, because mentally there's problems and wrong and things that need to be fixed, and that gives us kind of a downward problematic look at things. Even as I'm talking about it, I feel like I'm getting down. So if we think about improving, sometimes that opens up our thought process to a wider array of exercises. We can start to have a better overall lighter feeling about us. We want to improve all these things. We want to make it better, okay? And we're going to improve his shoulder range of motion, which is going to be big for him, especially because he wants to go back to the gym and start doing things. That's going to be helpful. Hopefully, as his posture improves, his shoulder mobility will improve. Right? We can think of those things coupled together, and his ability to have less shoulder pain. Right? So, as fitness professionals, we're not going to treat the pain. You'll notice that nowhere in the list of problems did I put anything about his shoulder pain, because that's not something I can directly say, I'm going to treat your pain. I'm not going to go in and do acupuncture or joint mobilization or Botox, whatever. I can't do that. But I can improve all of these different components of him, including his posture, which is a really big part of it, to give him hopefully less pain, better function, less pain. Okay? All right. We're also going to, we talked about his leg general lower extremity flexibility. We're going to improve that. We're going to work to improve his spinal mobility, so both into lumbar spine flexion and into thoracic extension. So those are two places that are very common. Included in all of that is better core control. So the better I can manage my body in relationship part to part, my rib cage to my pelvis to my legs, my arms to my shoulder girdle, all of those things together, as if we remember the core control is not just tighten the abdominals, right? But it has a postural component to it. So that's really going to help with all of the other goals that we have. And we'll work to improve his shoulder stability, which was pretty good. That was not one of the top main things, but it definitely is something that will help him with his shoulder health and feeling good. Okay.
Maybe we could add his personal goals, such as improving posture.
Yes, we're going to improve. We're going to do all three of his goals. We're going to rewrite that, because that's something we need to be looking at. The other reason I like to do that and really keep the personal goals in my mind is because sometimes, doesn't happen very often, but occasionally someone will come in with a personal goal that is really out of alignment with what is good or healthy, right? If I came in and said, to you that one of my personal goals was to lose 60 pounds, yeah, that would be bad. Think, how much do I weigh? If I wanted to lose 100 pounds, you might think, ooh, that's, that may need some addressing. And in that case, that gives us an opportunity not to work on that, but to refer it out to somebody else, right? Or if they have more pain than I know what to deal with, I'm going to refer out to someone else. If they, have some other, they report something else that just seems a little bit weird, you can then make a decision of, is this something you can address, or is it something that needs to be referred to somebody else? So, like nutritionally, they may ask you questions about better nutrition, and if you're not trained in that, it's really not safe for you to do that. So you can always refer that out, okay? So let's write those up. So dun, dun, dun. All right, so we're going to decrease, let me write that over so it's dark enough. Decrease shoulder pain. Go back to the gym, is that one? And improve posture. And return to gym. Okay, so those are his personal goals. All right, okay, so based on the goals, we're going to start to develop our program, our exercises. And so first, the easiest thing to do is start to select exercises that are going to help us with the goals. So just any exercise that might help. And I just want to add a little bit of clarity to the calf flexibility. Similar, not exactly the same, but similar to what we talked about with the shoulder in the prone shoulder flexion. I don't know for sure if it really is his calf, if it's a muscular restriction that he has, whether it's a strategy or whether it might be his ankle joint. So I'm going to put up there that it might be the ankle, and that's going to help me to know if I'm seeing some movement, especially maybe if he's doing footwork and he's doing the heel raises where he's stretching down and lifting up, and I'm noticing that there's a pretty significant difference. That might tell me that I need to get one of the physical therapists and have them take a look at it, because it might actually be his ankle joint, which I might not, in what we're doing, I might not be able to fully address that. So I'm just going to put that up there just as a note, because we don't know. Okay, so that's just to bring some clarity to that. So, all right, so let's have some exercises that are going to make a difference in his problems and goals that we want to include in his program.
So for that particular, like alignment, so footwork,
okay.
Maybe the trapeze table or the reformer.
Okay, trapeze table footwork or reformer footwork. Those are both good for him. One is going to be better at this point. Which one is going to be, if we think this is his very first session, we want to wow people in the first session, and or we don't want to turn them off. We don't want to give them so many things that they can't do that it's like, oh, you can't do that and you can't do this, oh, we have to modify this. We want them to have a great experience. So, reformer. And why do you say that? I agree that it would be the reformer. Why would the reformer be a better environment for him now? Maybe we do footwork with the tower bar on the trap table a little bit later. What do we need to improve before the trap table footwork is really accessible for him? Yeah, right. So he's lacking in hamstring flexibility. If the trap table was all there was, we could do it. We could make it work. But if we have the reformer available, reformer is probably a better and I'm just going to put an R. Okay. That'll tell us that it's on the reformer. Okay. What were some other exercises that will help us with any of those problems and goals?
Would the chair double leg pump also help with that too?
It could. Mm-hmm. Double leg pump on the chair, the seated leg pump. That would be good.
The hip or strap work, you can get for like your hamstring and inner thigh flexibility or the hip mobility, like any of those,
Great. On which piece of equipment?
The reformer.
On the reformer. Great. So that's the feet and straps. On the reformer. That would be a great one, and that's wonderful for getting most of those things. Good. All right. So we've looked at his legs. Let's pick some things that might help him with his spinal mobility or his shoulder mobility.
Segmental bridging.
Bridging. Okay. And which problem are you addressing, or which goal are you addressing?
Well, I mean, it's articulation of the lumbar mostly, but like you could, think too with leg stability, because you have to control like your legs, make sure your knees aren't going in there.
Right. There's some
more articulation.
Right. And there's one other thing that the bridging is going to help with.
Some of your core control, so you don't like.
Sure. How he has to manage how his pelvis lifts in relationship to his ribs. That's great. What else is it going to help with? Look on this side. Yeah. At some point, he's going to be in a little bit of a stretched position through his quad at the top of the movement. Great, guys. Really good. So let's, I don't really know where to put it because it goes in several places. So I'm going to put it under the lumbar, knowing that it's going to help with core control, with flexibility through his quadricep, and with his leg alignment. So in that exercise, so we're going to do it on the reformer, because that exercise addressed so many different problems or goals in his program, that might be a good note of something to do at home. So we want to have home program that helps us, really supports what we're doing in the studio. So we don't want to just give, go do 10 push-ups. Right? It doesn't really support what we're doing necessarily. So we want to teach him something in the session that he can take home and do as part of his home program. So I would say, if we're looking at that as well, put in bridging for a home program. Okay, that might be good for him. So I'm just going to write home down here, and we'll put bridging in there. Okay, so let's look at his shoulder. Let's look at shoulder range of motion, because that we know was something that really needed some addressing. So what would be some exercises that would start to address his shoulder range of motion?
Sideways, a little more. That thoracic and shoulder.
Okay.
So you go in flexion, but not opening the thorax.
Okay, that would be a good exercise. What might we want to do prior to doing that? What's he probably going to do when you give him that exercise?
Let his hips roll and things.
Yeah, and where does he not have the range of motion that he's just going to get it however he can get it?
In the thorax.
In the thorax he doesn't. We know that he has a little bit of decreased mobility there, and we know he's in a sedentary job. So his ability to move his rib cage is probably less than desirable. And he had a shoulder injury. So what I imagine, I don't know him, I don't know Bob, so I don't know what he would do, but I imagine if he's like my other clients, he'd start lying on the side in this way, and he'd start to move, and his rib cage really wouldn't move very much, and then his arm would kind of flop out to the side, and this would be left sticking up, right? So not a bad exercise. It's a great exercise. It's going to address several things, but let's pick something that we do before that then we can, in a few weeks, we can give him maybe that as a home program.
So work on some rotations maybe first, like easy, like side to side, supine.
It could. We could. So let's look at shoulder. Let's continue with shoulder range of motion.
Those arm arcs.
Great. Where?
Probably supine. What piece of equipment?
Exactly. What piece of equipment? And why would we choose an equipment exercise over a mat exercise?
Because you have the support of the spring.
Right. So people don't have problems moving their arms down here generally. Usually it's up here or out here that there's some restriction or pain or something's going on. So if you're supine on the reformer, as the straps are being pulled up, the springs are closing and the straps are coming up, I'm getting assistance into that range of motion that I may not be able to do on my own, or you can sometimes just with that little bit of pressure into the strap, it can help people have a better coordination of their movement. So we could start with some arm arcs, right? So he's working in the position, he's working toward the position he doesn't have any discomfort in, and he's getting assistance into the position that's not as easy for him to get into. He's got the feedback of the reformer carriage against his back. So if he was going to do something kind of funny, the shoulder rests are there, he's got feedback from the carriage, so he's going to have a better ability to move his arm there than just free in space.
He doesn't have to go so far either because he's going to stop himself.
Exactly, he doesn't have to go so far. So it's a limited motion. Great. So based on that though, what is his home exercise going to be? Arm arcs. Right. Exactly. So.
On the roller, would that you teach him on the roller?
The arm arcs on the roller?
Yeah,
possibly. Maybe.
Feedback for the thorax.
Great. I love that. So supine arm arcs on the reformer, we're going to do as part of his program. Arm arcs as a home program, possibly on the roller. Very good. I love that. All right. What else can we do? So we've looked at shoulder, we've looked at legs in terms of alignment and general strength and footwork and ankle alignment. What about thoracic extension? We haven't looked at that yet.
Maybe just like initially quadruped and just try to figure out the lengthening, thinking about just trying to lengthen the spine or get him into more of a neutral position as opposed to being arched over. Sure.
As a postural, as a way to start helping him with his posture, you could do quadruped, sure.
How about
Sure.
Swan exercises?
Okay, swan exercises for thoracic mobility. Where would you do that? On which piece of equipment? Right, so what are we thinking first? So this is his first attempt at these things. What does the equipment offer him? What do we want to offer him?
Well, you could do it if you put him on the chair. Maybe you put his legs on something like on the table or something like that. So when he starts to come up a little bit, he can get that feedback from the chair. He's not having to lift his back too much. He can get a little bit of feedback from the pedal to help him lift up and come down and just
Good, so swan on the chair, maybe with his legs supported, maybe not. We'll see how he does with that. So he's getting you mentioned feedback from the chair. What else he is getting feedback because it's kind of limiting how he does it. What else does he get from the chair? What's different about doing it on the chair versus doing it on the mat?
You're over in flexion where he's naturally is, and then he's going into neutral, and then hopefully to extension. On the mat, he's starting. He doesn't know, he might not have any movement up, so he might just feel like I'm not going anywhere.
Great, good. So that's a great concept. So you're starting him, you're meeting him where he is. I like that as a way of, it makes people comfortable. We don't want to stay there, but it's a polite way to get people into movement. Yeah, so he's used to being in this position. Now he has a range of motion to go in, and the pedals are pushing up on his hands through his arms. So what is that? Why are we choosing the chair? There's feedback, but there's also what?
For assistance.
Assistance. Assistance. There is a resistance from the springs that's helping to push him into the movement. So with assistance, he can learn how to do the movement. And then, as you said, we don't want to challenge him so much at the beginning where he goes into his poor pattern that he already knows how to extend from his low back. So we want to really teach him how to extend through his thoracic spine first, and then take that back to something like in the mat or eventually a more challenging exercise. Great. So swan on the chair.
So this is the proscapular series, is that what you're talking about?
It's part of that. It's part of that series. So that's the prone scapular series would also be appropriate for him. It'd be great for him. And we might look at that as maybe improving his shoulder stability. Right, and then going on into I'm going to abbreviate SCAP series on the chair. Okay, but the swan is actually moving the body from a more neutral or slightly flexed position, coming up into the swan.
Did you do that on the chair?
Same exact position. So you can do them together. You want to maximize your time on the chair. Getting on and off of the chair, depending on where it is, even when it's just out in the center, is kind of, it's weird. It's got things that move and it's small. So you want to maximize your time there. If you can do one or two exercises, if you do two exercises instead of one exercise, sometimes it's better. You don't want to be there forever, but it's helpful.
Chair, you prone on the stomach. I mean, you prone on floor.
I know like when you put on top of the chair.
Yeah, it's the same position as you would do the scapular series in. Good. Okay.
Roll down series.
Sure. Where would you like to do that?
Of course, the mat, but we don't do reformer.
Okay, roll down series on the reformer. We also have roll down series on the trapeze table. So for him, both would be great. If we were limited to, if we had one piece of equipment or another, either one of those would be fine for him. But if we had a choice, which one is going to help him a little bit more, is going to address a few more things for him than just the spine mobility?
The trap table, because you can get the hamstring extension, and your legs can stay straight. You get a little bit of flexibility through there.
And what happens as he's rolling down? It's not exactly the same, but it's in a similar area that he needs to work on. Lumbar articulation, core control. And remember, he didn't have very good hip flexor mobility. Now we're looking at it in the quadricep. It's a little bit different, but it's the same area. So if we can teach him how to roll down and lengthen, it's not going to address the quad specifically, but it is, again, it's going to help him with his total mobility there. Okay, so let's put that. We'll put that up here. I'll put it beside the bridging, knowing that it's for several things. So roll down on the trap table. Good.
So for later on, I see like the spine corrector, that roll down reach. That's a little bit maybe for later on.
For roll down reach?
Yeah.
Possibly. And he may, we think sometimes, and this is why it's important to remember that we're doing this on paper as an exercise to work out the kinks and bugs and to practice and to go, ooh, no, that's not the best, or that could be better, and that's part of the learning process. Remember, you're really going to be working with the person in front of you. And we don't want to ever bombard somebody with things that are too challenging, right? We're coming here to exercise, and this is Pilates, and we're going to do all these things that I want you to do. No, you're going to look and see how they do. So somebody who's a little less conditioned, a little less athletic, a little less switched on in their body, you're going to give some things that are a bit easier to do. You don't want to do that necessarily for somebody who's sporty and athletic, right? You might bore them to tears doing all of these, let's just do this, minute pelvic clock. That might not be stimulating enough for him. So we want everybody to have a positive experience. So roll down on the trap table and then see if you can roll down without the springs. They may, once they do it a couple of times with the assistance of the springs, they might be able to do it just great. Maybe they just didn't know how to do it. Or it sometimes is helpful because they'll start to do it and they'll realize, oh, I really don't know what I'm doing here, and the springs are really helpful. So it gets people to buy into what we're doing, and it demonstrates how helpful the equipment is, and reminds them how challenging some of the exercises are. So you kind of weave those things together. So roll down reach for him, he might be able to do it in a modified way, and it might be really great. He might love it. Right? He also might not, it might be too many moving parts for him to do. So that would be one we would kind of see, on paper, if you were writing this down to hand it in, I probably wouldn't put it down because you could do supine stretch on the spine corrector, which might be a better choice for him because his head is supported with his hands, his shoulder's not at a fully flexed position, and he has the support of the spine corrector as he's going into extension. So that might be a better choice. But in real life, maybe he could do it. So we don't want to limit ourselves and give people the most basic things and never see if they can do more. We have to balance that.
So the ladder barrel back to forward bend, that ladder barrel going back, that also is pretty much the same exercise. Right?
In back to forward bend or supine stretch?
1 and 2.
Right. So that's back to forward bend. Now that I probably would not put in the first.
Right, not the beginning.
No, it'd be a goal for him. It'd be a great exercise to work into. And again, the supine stretch would be an appropriate place to start because it's easy to modify. He's lacking the spine mobility in both directions, hamstring mobility, core control, and shoulder range of motion. So back to forward bend in the beginning wouldn't be good. But I like your thinking. It's like, when can we get to that point? When could we do that? That'd be wonderful. Yeah. Okay, so in Polestar we have the standing hip stretch, right? The standing hip stretch, we can see how he would do it that. We know he's limited a bit in his hamstring flexibility. So the initial push back, he might not go very far. But again, it might be interesting to him. He might be able to do it in a limited range and it might be okay. That might be a good stretch for him. Okay, let's see if there's anything else we've missed. So we've looked at core control. We've got bridging for core control, a roll down series. We're missing something that's going to take him into lower extremity alignment and balance. So what could we do that would help him in especially the balance in his lower extremity alignment? So where does he have trouble balancing? Standing up, right? On the right leg, but standing up. So we've done a lot of things laying down. Now, let's see if we can help him in a standing position. So is there an potentially assisted exercise in standing that's going to help him with his alignment and help him with his balance?
Well, could you do like the assisted like squats or something off of the Cadillac where he has the anything bender? You
could, potentially.
The double leg pump, which could you do it with one leg? So he's
You could.
But
yeah, so the squats would be more functional. The squats would be something getting him up and down, which I think would be a great exercise for him. It's not necessarily going to address his balance. Neither will the sitting one. So if I'm sitting doing the leg pump, I can work on my alignment. I can work on my core control, but I'm not going to work on my balance. Sitting on my bottom is going to be pretty good. So what could you do in standing?
Face the chair, hold on to the
yes.
And do one-on-one marching,
right, or just the standing leg pump. Right, so standing leg pump, I can stand against the chair. I can hold on to the handles at first. So we also have, again, assistance, not in terms of the movement, but I have assistance in terms of the posture, right? Because if I have him holding on, his weight is going to be shifted a little bit forward. He's going to be able to be there. Now we've got the leg going up and down, so we're not going to take him to the full movement of the heel raise, but we can start to address, how do you stand on one leg? Then he can go to one hand or no hands and see how that goes. And that's a great exercise for posture, for everything that we do in standing, because people have very poor understanding of how to work in standing, how to stand, right? We have this posture, right? There's lots of deviations from normal. So I would make sure that we're giving him some standing work. And when we talk about the sequencing, when we talk about how, so we choose all these exercises, then what are we going to do with them? When we talk about that, we're going to want to make sure we include standing exercises, because that gets people ready to leave and keep going with their day. So we don't want to continually keep them lying down, because then they never have that transition to standing, which they need for their daily activities. So it's functional.
One that we did yesterday on the reformer, where one leg is on the stable portion, one on the moving portion.
Good. Right, the standing series with the standing leg slides. I think that would be great for him. Sure, sure. That would be good. Not on the highest reformer, down on the low one. No, it's fine. That would be good for him. Because again, much more of a component of core control than we think about. We think core control, let's do crunches and chest lift and lots of abdominal work. But core control, you know, does he stand like this or like this? That's going to affect his ability to balance. Maybe he can't do the heel raise because his posture is really poor. So maybe this is his heel raise, right? And he can't do it. But if we improved his posture, maybe now he can do his heel raise with ease. Don't know, but that's our thing. Right. It's certainly not going to hurt him to have a little more stability through there. Good. Okay, great. All right, so eventually we will start to put these exercises into an order, and we'll start explaining the sequencing and how we do that with each one of the exercise plans. So in terms of the exercises that you have available to you from the S1 course, we realize that some of the ones that I talked about you haven't had yet, or you've had versions of it. So in the articulation for the thoracic spine into extension, the swan on the chair is an assisted version of the swan that you've had on the mat, rolling up through the spine, coming up to the knees in extension and rolling down. So that would be an appropriate exercise for him. And you've also had the supine stretch over the spine corrector, where you're seated, the knees are bent. It's a fairly easy starting position to go into thoracic extension and come back up. So either of those would be good for him. The supine stretch has the sense of assistance with gravity and being supported by the round arc of the spine corrector. So that would be a really nice introductory extension exercise for him. In terms of balance, we realize that there aren't a lot of, you haven't had any standing exercises. So for the future, as you're looking back at these case studies and reviewing and maybe doing them again and choosing different exercises, the standing leg pump on the chair would be one of the great exercises for him in standing. And to mimic that for right now, I would stick with footwork on the reformer, because it puts him in the same position to himself while he's doing the standing work. It just is not in the same orientation to gravity. So that's where I would go with that. And he's had bridging as a home exercise. You learn that on the mat as well as the arm arcs. So the arm arcs on the reformer are going to give you assistance, and you'll have that in the future. Any others? I think that's it. Okay. So we know that, and you'll get to have those exercises in the future, and you'll be able to fill in the blanks.